I'm Dr. Preeti Poghe and today we are going to talk about the Jehovah's Witness. So all of you who are studying for your part 2 must be knowing about Jehovah's Witness. Basically, these are the group of people who don't allow blood transfusion because they have a belief that transfusing blood, someone else's blood, is actually a sin. So they don't allow a blood transfusion even if they are bleeding to death. So in such situations, you should be knowing how to handle this patient and what all can be done if the patient doesn't allow any blood transfusion. If you are sitting in your clinic and you're coming across a patient who is ANC, or you are taking consent of a patient who is going to go for a surgery. So in those cases specifically, these things matter because these are the patients who have a very high risk, who have a high potential to have blood transfusion if they bleed while having a surgery or during their pregnancy period. So in these cases, you should be asking the patients about the history and specifically about their beliefs regarding blood transfusion. So if you know that this patient is a Jehovah's Witness, how will you help this patient? So you have to ask these patients whether they allow any fraction of blood. For example, there are WBCs, plasma that can be transfused. So some of them can allow you transfusion of these fractions of blood when they are bleeding. Some may reject even that. Some may reject the blood completely. So, if you know that this patient is a Jehovah's Witness, you have to document it in your history or while you're taking your consent. And you have to be ready whenever this patient bleeds, what else you're going to do. So, you have to be ready with something called as cell salvage, which you must have heard of, or even the hemodilutions like giving the IV fluids to maintain the circulation. So when you know that this patient is not ready to have blood transfusion, cell salvage can be made ready. Cell salvage is a machine wherein if the patient bleeds, his or her own blood is taken up by the machine. It is washed and filtered, and then it is again transfused into the patient's body. So the patient is getting transfused by his or her own blood. So that is called as cell salvage. So one has to be ready with all these things if the patient is to be taken up for any kind of surgery where there is a chance that this patient may bleed a lot, or there is a risk that this patient may require a blood transfusion. If you find that there is a patient who is unconscious and the patient is bleeding, so how will you take care of this patient? If you don't know that this patient is Jehovah's Witness or not, you have to look at any advance directive that this patient has given, or the patient has got any power of person who is having a power of attorney who can take decisions on the patient's behalf. There's nothing that you can find in that way. In those cases, you have to discuss with your seniors about the treatment of the patient and only then take the decisions regarding the patient's treatment. So I hope this video has helped you. Thank you very much.